Cebu tweaks lockdown policy, issues test rules. As Cebu province topped the list of provinces and cities with the highest cases of coronavirus disease 2019 or COVID-19, Governor Gwendolyn Garcia on Monday, August 9, 2021, tweaked the national guidelines on the use of rapid antigen tests and ordered that granular lockdowns be imposed per purok instead of per barangay. In her virtual meeting with the mayors Monday, Garcia said the objective now is to contain the rapid transmission of COVID-19 in the province. Cebu province on Sunday, August 8, jumped to the top of the list of provinces and cities with the highest number of new COVID-19 cases. Department of Health or DOH Undersecretary Maria Rosario Vergere said in a press conference Monday that Cebu had 664 new infections, followed by Cavite with 556, Laguna with 528, Bulacan with 487, and Quezon City with 431. Cebu province as well as the cities of Cebu, Mandawi and Lapu-Lapu have been placed under Alert Level 4, an early warning system that guides local government units or LGUs on how to address an outbreak. Under Alert Level 4, the local government units or LGU must impose granular lockdown, undertake active case finding and use rapid antigen tests, urgently increase hospital beds, ensure enough oxygen supply, ensure accessibility of PhilHealth benefits for COVID-19 patients, and immediately refer severely and critically ill patients. The new rules. During their meeting, Garcia and the mayors agreed that if COVID-19 affects 10% of the households in a purok zone, the entire purok would be placed under lockdown after assessment by the mayor. In the matter of containing transmission, we set an across the board per purok and dili na or no longer per barangay. I give this to the mayors. You mayors are in the best position to know the actual situation, so you and your emergency operations center will determine when to impose a lockdown, Garcia said. She noted that based on the policies being imposed by the Interagency Task Force or IATF for the management of emerging infectious diseases, LGUs are authorized to impose granular lockdowns. Restricting a purok instead of a barangay would allow other residents who have not contracted the contagious disease to continue working for a living. Garcia said an executive order to cover this revision would be issued as part of active case finding meanwhile. As part of active case finding, meanwhile, those who manifest symptoms will be subjected to a reverse transcription polymerase chain reaction or RT-PCR test for SARS-CoV-2, the virus that causes COVID-19, while they are under isolation for 10 to 14 days in a temporary treatment and monitoring facility. First-generation contacts who are asymptomatic will be subjected to a rapid antigen test, while undergoing isolation for 7 days at home. They are required to wear a face mask. Under IATF Resolution 130D and DOH Memorandum to 2021-0169, the RAT may be used to confirm suspect or probable cases and close contacts Those who get a negative result must undergo RT-PCR test. A rapid antigen test detects the presence of antibodies in the blood, which indicate that the individual was or is infected. It does not detect SARS or COVID-2, unlike the RT-PCR test. In late March 2021, the DOH allowed the use of the rat in the NCR+, which was then experiencing a sharp increase in cases. On August 6, Verheerij also announced that RE tests may be used in areas placed under alert level 3 and 4. However, the results of these tests are not included in the DOH case bulletins because the DOH has to rely on reports from the LGUs. Verheerij on Monday called on LGUs using this test to submit complete reports to the DOH. An area's COVID-19 case count impacts on its rest and quarantine classification, which is based on the 2-week growth rate and average daily attack rate, among others. The lower the number of cases and the rate of increase, the less stringent and quarantine classification is. Next, we will talk about Delta variant. Given the rising cases in Cebu province, as well as in the cities of Cebu, Mandawi and Lapu-Lapu Central Visayas region had the third highest number of new cases at 1,412 on Sunday. The National Capital Region or NCR posted the highest infections at 2,325, followed by Calabarzon or 1,562, following Central Visayas where Central Luzon 1,025 and Northern Mindanao 635. The 5 regions along with 8 other regions have COVID-19 cases caused by the highly contagious Delta variant. The Delta variant has now been detected in 450 cases in 13 regions, 26 provinces, and 29 highly urbanized and independent component cities. Verheerij said 10 had died, 13 cases remain active, and 426 recovered. The outcome of 1 case was still being verified. Of the total, 146 are in the NCR, 47 in Calabarzon, 37 in Central Visayas, 39 in Central Luzon, and 22 in Northern Mindanao. The 8 other regions with Delta cases are Ilocos 5, Cagayan Valley 1, Bicol 1, Western Visayas 36, Eastern Visayas 11, Zamboanga Peninsula 3, Davao 6, and Cordillera 1. More than half of the patients, or 248, is 55% are male. The patients included infants under 1 year old and adults 84 years old. Of the 450 cases, 69 are returning overseas Filipinos or ROF, and 355 are local cases, which means they have no foreign travel history. As of Sunday, Verheerij said they have verified that 35 of the cases are fully vaccinated, 17 have received 1 dose, and 83 are not vaccinated. They were still verifying the vaccination status of 315 cases.